I had all those videos of me and Matt Hancock, Boris Johnson, and this is how they reward them. Isn't it extraordinary?
So they're going to...
the first thing we're going to do to reward you...
is make you pay.
Is we're going to make you pay to park at hospitals again. Because that's really the mood of the nation. Yeah, let's make all these nurses run out of money. Let's make sure that they have to pay for the privilege of parking at a hospital. What a total shambles. So we have to start a new campaign now, don't we? The new campaign has to be, are we in all good conscience, as a country, are we going to go back after this, knowing there might be another wave of this, and knowing what we've put health workers through, knowing how many have died on the front line, are we going to go back and charge them for the right to park at a hospital? If we think that is the way this country should treat our NHS heroes, then it's not a country I want to be part of. I don't believe that's what most British people want. And once again, the government is completely tone deaf. And I don't want to have any more videos of these people clapping the NHS and care workers as if somehow... There he is, look, this is this week, Boris Johnson. Absolutely, fantastic people, fantastic people. Now, can we get them to charge them for parking again? That's his reward.
Bear in mind, of course, that a lot of healthcare and care workers won't be wanting to get on public transport at the moment because of the risk of infection. So a lot more of them will be driving
Hillary, you've raised your hand like a good boy at school.
Absolutely, because I will be the very first signature on that campaign to abolish car parking for NHS staff. Do you know what? They've abolished nurse bursaries already, which has been a disaster. Less nurses signing up to go to university to develop those skills. Also, they sold off all the land. When they had far more beds in NHS hospitals a few years ago, they sold off buildings, they sold off land, and to make a quick buck, they sold that commercially. It didn't go back into the NHS, and they didn't think ahead about parking that was going to be necessary for staff, and so they were asking staff to pay £20 a day in most average hospitals, but up to £77 in some hospitals.
I mean, think about that.
Per day.
It's unbelievable.
Which is unbelievable. And you know, there are no perks for NHS staff. They work over and above the hours they're actually paid for because they have to, and that's what they see as their duty. They don't get any... They often miss out on their coffee break. They often miss out on their lunch break. And I think if we're going to encourage people to do the kind of heroic work they've been doing, we need to support them. And absolutely, first name on that campaign would be mine.
Well, your second name, because I'm first.
All right, fair enough.
You can come second. But your name will carry more clout.
In London as well, of course, NHS staff face the increase in the increase and the extension of the congestion charge. So it seems extraordinary that NHS staff and care workers, when we know the value of what they've done, particularly in this pandemic, suddenly face increased costs.
Absolutely.
There's also a security issue for nurses. If nurses are doing shift works, I know so many have been assaulted or attacked on the way to work, trying to walk to the bus stop or get the train because they're doing antisocial hour shifts and it's dark in the middle of the winter. It's a security risk as well.